Hey guys, I hope you're doing well. This is just a review of exam one. I pulled some of the top missed questions from everybody and just kind of wanted to review the content a little bit, just so you feel a little bit more comfortable and settled by the time you get to the final. Okay, so one of the top missed questions did talk about hyponatremia, remember, low sodium. And it's what is the number one focus of care when you have a patient with that severe low sodium or hyponatremia? And the best thing you can do is prevent it from getting worse. Okay, so our kind of goal with that would be to not give hypotonic solutions, because what hypotonic solution does is it helps bubble up the cell. Okay, because that's kind of the goal. But what it's going to do, the best thing you can do is strict fluid restrictions. Okay, so if your patient, usually in this kind of state, they're thirsty. It's just kind of one of those things that happens. And if they drink water or drink anything, that already hyponatremia is going to get worse, because they're going to have even less sodium because they're overhydrated in some ways. So the best thing we can do for those people is strict fluid restrictions. Yeah. Another question talked about an ER patient, and they come in with absent breath sounds on that right thorax. Okay, what that usually means is a tension pneumothorax. This is a medical emergency, because what that does is it completely collapses that lung and they can't breathe. Okay, so a lot of people picked emergency pericardiocentesis. An emergency pericardiocentesis, say that 10 times fast, is when they just open up and they're trying to pull fluid from around the heart. Okay, that's the cardio of that. When you're thinking peri, around, cardio, heart, centesis, to pull off. Okay, so we really don't need to pull anything from around the heart. We need to reinflate that lung and pull everything out of that lung. Okay, so what are we going to do? We're going to put a chest tube in. Okay, what a chest tube in is it pulls air or fluid out of that lung. Okay. What does an assessment of a viral upper respiratory infection that indicates that antibiotics might be needed? Okay. When somebody has that, it's not, a lot of people went for like, they have a ton of nasal drainage, they have more symptoms kind of idea. The idea is actually always think of your ABC, right? A being airway, B being breathing. If they're having trouble breathing, dyspnea or chest tightness, then they're going to have more issues. Okay, and that's when we usually want to try antibiotics, because they might have a pneumonia or something like that. Okay. A patient is admitted with a diagnosis of acute asthma. What shows that the patient may need additional teaching? And this, I'm just bringing this one not to talk about the answer, but to make sure that you take the time to read your question, because a lot of people answered this question, like it's one of the most missed ones, because you looked more at what they should do instead of they may need additional teaching. Okay, so if they're using more albuterol more frequently, that tells us, hey, they are not either using correctly, they need additional teaching of what to use and what timing to use. Okay, where the other questions, it's more of a, oh yeah, that's definitely what we should be teaching them. Okay, so anytime you see bolded words like may need additional teaching, priority, what is your first, those highlighted words, that's to kind of put it in your brain of those priority questions, which are some of your harder questions. Okay. Let me think. The last one I want to talk about is a confused older client comes in with restlessness, decreased urinary output, those kind of things, and their sodium level is 150. So super high, right? So what do we want to do to that patient? We actually want to give them isotonic fluid to help pull that sodium back in. Okay. A lot of people kind of went to, we should give them 3% normal saline, which was the second answered. If you think 3% saline has tons of sodium in it. Okay, so if their sodium level's already 150 and we give 3% saline, we're giving them concentrated sodium basically, which is going to make that sodium level even higher. Okay, so just a reminder, exams are hard. Okay, this is, if you set the foundations now, you will succeed in the end most of the time. Okay, so you really have to learn what works for you. My highest thing is don't cram. When people tell me, yeah, I only studied the day of the exam, 2 days before the exam, even 3 days, I'm like, there's so much content that you cannot grasp. Okay, so start from day one. I put the exam practice, or like the exam ideas to pull out. I highly recommend you print those out, write those down, and really highlight those and start thinking about those at week 5, at week 6, at week 7, before you get to exam on week 8. Okay. I have had a couple of questions of don't take it right after clinicals, right? If you're already tired from work, those kind of things. If you're exhausted, you need to kind of plan ahead. If you know you work Tuesday, Wednesday, take the exam Monday. Those kind of things. I know that's hard because you want to be able to study till Wednesday, but I'm telling you, if you come off a 12-hour shift or even a 6-hour shift, right, you're tired, or clinicals or anything like that. So kind of think of it in advance. When is the best time to take this exam, and plan from that point. Take lots of practice questions. There's extra practice questions in SurePath. There's also questions in ATI. The more you take these questions, it's not always about content. It's how to see these questions. And don't just take the extra practice questions. Look at the rationale, because the rationale is going to give you hints and tips that's going to help you in the future. Okay. You can read the questions out loud. Okay. So some people that are like, they can't really focus in. If you need to read it out loud, that is totally fine. ABCs is a priority. Okay. Airway, breathing, circulation, like I talked about earlier. If you're like, man, I do not, it's a priority question. Think first, ABC. Is it an airway issue, breathing issue, or circulation issue? Okay. Last thing is just a reminder about your environmental video. When you're showing your environment, it is extremely important, okay? I have to go in and review all those environmental videos, which is good. Keep you at a higher standard. Take the time to show your actual workspace area, okay? I don't even care. You can see my dirty kitchen behind me. You can see this. I don't care about those things, okay? What I want to see is that you have no thing that's going to kind of be your cheat sheets, any like that, okay? This is going to get you further ahead in life. Please don't try to cheat on these exams. This is going to prepare you for the NCLEX. So you really want to take the time to do it right now, okay? If you have any questions, if you want to meet, if you want to do anything like that, please always reach out to me. I'm happy to either set up either email or sit and we can do a Google Meet or something like that to talk in person, okay? Well, as always, let me know if you need anything. Thanks.